Next speaker, speaker number 9. You have 4.5 minutes.
Good afternoon. My name is Amy Barnett. I'm a trained nurse and women's health advocate. I'm here to represent the thousands of patients suffering symptoms after metal clips were implanted in their bodies. Although clips are small, all implants are capable of causing foreign body or autoimmune reactions. However, most doctors rarely acknowledge this, so the issues go unreported or misdiagnosed. In 2010, my doctor chose to use Filshie Clips during my tubal ligation. She told me the day after surgery she used them. Despite numerous tests by various doctors, I was reassured the debilitating pain and 32 other symptoms I developed could not be related. A year later, in an attempt to avert my symptoms, I had my clips removed during a tubal reversal, and I made a full recovery. I went on to create a Facebook support group to educate and share my experience with others. During this time, I was able to graduate nursing with honors. However, in 2015, I became ill with mononucleosis, which triggered a relapse and development of 34 symptoms, very similar to when my tubes were tied. You each should have a handout of all of my symptoms as well as my medical records if you'd like to take a look while I'm speaking. Chronic fatigue, severe inflammation, and a variety of other symptoms have taken over my life, ending my career as a nurse. Daily, I struggled to take care of myself and my children. For 4 years, my doctors and thousands of dollars worth of tests have been inconclusive. It wasn't until recent that I learned about Asia syndrome. I was shocked to learn all of my symptoms fit the description. However, I didn't believe I had any other devices. That is until one day I read one of my old CT scans from when my tubes were tied. Apparently, gallbladder clips had been placed without my consent in 2005. Not only was I never told I had them, I've also come to learn they are not noted in any of my post-op reports. My experience is not unique or uncommon. I've spoken to hundreds of patients throughout the last 8 years with similar symptoms, but doctors deny their issues could be related to the clips. Without acknowledgement of an adverse event occurring, nothing gets reported. Incompetent reporting means the data doesn't represent real-world effectiveness or safety. It goes without saying comprehensive records are essential in healthcare. However, staples and surgical clips are rarely documented in a patient's record. The patient or the doctors providing follow-up care are all too often unaware they have them. Should adverse reactions occur, the device itself is rarely suspected, either because no one knows it's there or because the doctor believes the device is safe based on FDA recommendations, which are based on flawed data. It's a vicious cycle, making it imperative every device be documented and tracked. Without the brand or alloy composition, allergy testing cannot give a definitive diagnosis or resolution after a device has been implanted. It is crucial metal component documentation be kept for the life of the device and not a standard 10 years, because symptoms can present differently for every individual or can be delayed, as mine were, giving rise to misdiagnosis for years or decades. A set standard of metal allergy testing before placement, along with autoimmune acknowledgement and protocol for removal, are vital for safe and effective patient care. In circumstances of migration, doctors are leaving them free to embed in vital organs, telling the patient they are harmless. However, scar tissue can form around the device, further complicating removal and risk to life. Migrated clips are not benign despite common medical opinion. Even those intact, functioning as they were intended, can negatively impact one's quality of life. Patients are not given true informed consent, including the topic of migration or an increased risk of autoimmune symptoms occurring, and have had their right to autonomy violated. These are lifelong devices, needing lifelong evaluation and tracking if we are ever to learn their true impact on the human body. While most patients are not medically trained, it is their right to full informed consent before placement of any device. Advances in technology can extend life, but circumstances of non-life-threatening surgery, the patient has the right to decide if their body should have a device. I am walking proof that no matter how small the device, it can have devastating consequences. Please end the cycle of this suffering by ensuring these devices are tracked. Only then will we have accurate data to scientifically show their safety. Thank you for your time.
Thank you, Ms. Barnett.